you know, so I was a nurse at the time that I got diagnosed with leukemia. So I didn't really know a lot about cancer because I wasn't directly an oncology nurse. But I educated, like you've talked to people about, I educated myself very quickly on like what's going on, learned all the stuff about it. And there wasn't very good treatment for it. So, I was at the Brigham and Women's in Dana-Farber at the Cancer Institute. And basically, they told me that, they could keep me alive with these drugs, but eventually it's going to, it will kill me within about a year or two. And that didn't seem like a good option at 28. And so they said there is another opportunity, and it's a donor transplant. And back then, I'm in the dark ages, if you will. They said 4 people die as a result of the actual transplant. So the treatment, there was 1 in 4 people die because of the transplant, usually within like the first year of the transplant. But if it works, you can, you can live a long time, because it is a cure in some instances. And this was before they had all these other drugs that like Gleevec and Sutent and all these things that are tyrosine kinase inhibitors that have changed the game. But back then it was do this or and die within or you get it, I can swing for the fences, if you will. And it was that was 1996 was kind of horrific because so I got diagnosed on August 2nd, I believe it was. My wife's brother had a grand mal seizure and died on August 20th. So and he was 30 years old. So and he had special needs, and that was why my wife was a special needs teacher. So my wife's dealing with a man who's she's married to, who's a basket case, and she just lost her brother who meant the world to her. And then they tell me, well, we can go get a transplant. So and so I had the transplant, and it was not, there were lots of issues with it. I had a lot of complications. But what I kind of, the physical stuff wasn't, it was difficult, but it was the emotional stuff that really I struggled with. But it was the doctors, the oncology nurses, the nurse practitioners, the physician assistants. I was amazed at the quality of care at the Dana-Farber and the Brigham and Women's, as far as like they were experts, which I had been a nurse for a while, and I didn't really consider most of the people I was working in home care, and I had done other things. I didn't see the expertise and the kind of like I'll call it a finely tuned machine, but also they were all emotionally aware of what was going on for me as a cancer patient survivor. And I kind of was, I was in awe of, like, I was like, oh my God, I couldn't have got through this without them. And I want to do this. So, I came out on the end, and I still don't know if I'm going to live or anything, but I'm like, it was, I told my wife, I said, I think they'll never hire me as an oncology nurse, even though I'm an RN, because, you just can't do that. So I had to figure out, how do I have to game the system? And I'm like, all right, I'll go back to school, become an NP, and then I'll get my I'll get my clinicals at Dana-Farber. And I did that, and that was another that was completely insane. I got into school, and the dean and the assistant dean just loved my story of, like, couldn't believe I'm doing this, and and I sacrificed a lot, and my wife sacrificed a lot. We had our oldest daughter now, but she was a baby. My special needs uncle lived with us, and I was working basically 3 part-time jobs while going to school full-time, because I was so passionate that I want to be part of what I was so amazed and grateful to them. I wanted to do this for other people, because I wanted to give back, because I felt like I owed them. But it gave my life a purpose that I don't think I had before that. I think it was more, I was very money driven, and I was very goal oriented towards, things and stuff. And this really, help focus a type A personality in the right direction.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of MantaCares Inc. or MantaCares' sponsors.